We don't all fit into the same mold, so to speak.
That's because there are different reactions to different treatments. So much is unknown about how our bodies react to treatments, especially for African Americans. A local doctor taking matters into his own hands and putting what is known on paper.
Most of the research is done on the majority population.
Some doctors' offices hold sickening stories, tales of historical lack of care for black vitals.
I have a 80 to 90% African American population.
That's why Dr. Gregory Hall made a promise to the people. Dr. Hall says his 25 years of experience shows beneath the surface, we're all pretty much kin.
We're over 99% the same.
But in medicine, it's the little things that make a big difference.
It's that 0 point whatever percentage that makes all the difference. That's what's impacting, infant mortality and diabetes and obesity and kidney disease.
So he's written a book, not a cure-all, but a tool to help his colleagues help his people.
It wasn't easy to get that book published, quiet as it's kept. With over 40 million African Americans in the country, you would think.
Dr. Hall spent 2 years writing patient-centered clinical care for African Americans.
It's still surprising to me that I had to be the first person to do it, quite frankly. And there's a sort of a gap between researchers and the university level and physicians that are in the community actually seeing patients.
He breaks down differences that could be the difference between folks living and living longer.
For colon cancer screening, screening starts at age 50, but in African Americans it starts at age 45. Chemotherapy medications for breast cancer work better in white women than they do in African American women.
Now his patients are passing along doses of awareness, trying to get other African Americans to see their doctors.
An ounce of prevention was better than a pound of cure.
Samuel D. Craig III and Dr. Hall go way back. And Dr. Hall isn't just fixing patients. He's fixing the mindset of people in the medical field. He serves as co-director of the NeoMed Partnership for Urban Health at Cleveland State University, where students also pick up what's inside this book.
Providers are now being impacted by their outcomes.
Now, Dr. Hall says this version of his book was written for providers, but he's considering making a version for patients.